Delighted to be joined by three presenters today from three different institutions, whom I will introduce now. So we have Eton Boco, who's an analyst at Health Statistics Division at Statistics Canada. We have Emma Nolan, who is with the Offord Centre for Child Studies at McMaster University. And we have Adam Probert, senior epidemiologist with PHAC, which I always called PHAC, which I understand I'm in the minority in doing. Before we begin today, I'd like to acknowledge that McMaster University, as the host institution for the Canadian Research Data Centre Network, is located on the traditional territories of the Mississauga and Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. We'll begin the session today by giving honor and thanks to the Haudenosaunee and Anishinaabe Nations, and to recognize our responsibility to respect and honor the intimate relationship Indigenous peoples have with this land. You can visit Native Land Digital, a space where people can learn more about the lands they inhabit, the history of those lands, and how to actively be part of a better future going forwards together. And without further ado, because we have a lot of presentations today, we are scheduled for an hour and a half. If you need to drop off at any point, we will be posting the full recording. I understand at least one of the presenters will be making their slides available, so we'll try to make as much of the material available ex post as we can. And without further ado, I'll turn it over to our presenters.
Okay, I'm going to go first. I'm going to go ahead and share my screen. Just give me a second. Okay, let me know if you can see the screen. Okay.
We see you just fine, Eton.
Okay, awesome. All right, so starting off, hi everyone, my name is Eton. I'm an analyst with the Health Statistics branch of Statistics Canada, and I'm also one of the analysts working on 2023 Canadian Health Children and Youth. So a quick overview for this presentation. We're going to be going over CHSCY's mandate and objective, the design and content for CHSCY as a whole, and then the dissemination plan for CHSCY 2023, and of course the future work or the future of CHSCY at. So first things first, the mandate for CHSCY. CHSCY was created first and foremost to sort of provide a picture of the health and well-being of Canadian children, and it's feeling quite a big data gap for Canadian children and youth, or Canadian data on children and youth, seeing as the last survey focused solely on what was I guess published back in 2009, and it was called the National Longitudinal Survey of Children and Youth. And so that being all the way back in 2009, there was a bit of a data gap to be filled, and so that's where CHSCY came in. And it covered important topics on children and youth. So that included physical activity, chronic conditions, injuries, nutrition, and so on. And yeah, and so that was sort of why CHSCY came to be. Hold on. My computer is stuck. My screen just went blank. Hold on, give me a second. Okay, awesome. All right. So this is an overview of the design of the two iterations of CHSCY so far. First survey was back in 2009, or 2019 rather, and it was cross-sectional. It covered children between the ages of 1 and 17 years. And the survey was completed by the parent or legal guardian, which is also known as the person most knowledgeable. That's the PMPA for short. If the child was between the ages of 12 and 17, they were sent a separate set of questions, which was sort of different from the one that their PMK answered. It contained questions that were best answered by the parent. The 2023 survey, on the other hand, has two components, a longitudinal component and a cross-sectional component. The longitudinal sampling units are children and youth from the 2019 sample, and they're being followed up with in 2023. These kids or these children and youth are therefore between the ages of 5 and 21 as of January 31st, 2023. And that was the time of sampling. The 2023 survey also has a cross-sectional component, and those children are between the ages of 1 and 17 as of January 31st, 2023, which is the time of sampling. The similarity between these two iterations, 2019 and 2023, is that your survey flow sort of determines the kind of questions you get in the survey. So people between the ages of 1 to 4 get a different set of questions than people who have children between the ages of 5 to 11. Another similarity is that 12 to 17-year-olds, both in 2019 and 2023, are sent a separate questionnaire or a separate set of questions that's different from what their parents are going to answer. The one difference, or one of the differences between 2019 and 2023 in terms of design, is 2023 consists of longitudinal components that are between the ages of 18 and 21, and they answer the survey entirely by themselves. So there's no portion for their parent or their legal guardian to complete. And another important similarity is that tax data is available for linkage to the data for you to obtain income information on respondents or the households of respondents. Going on to content, I'm going to breeze over the next 2 slides or the next 2 content slides just because CHSCY does have a lot of content. It's a large survey, but I do want to highlight the differences between the 2019 survey content and the 2023 survey content. And just for those that are not familiar, the modules are defined as, think of them as sort of like themes. So for instance, the general health module contains questions that are general health themed, basically. And you'll notice that I've placed an asterisk on some, and that's just sort of to show that these modules exist in both years, granted, but there are slight modifications. So a question has been removed between the 2 years, a question has been added, there are changes in the text of the question and so on, but for the most part, these modules exist in both 2019 and 2023. Up next are module differences between 2019 and 2023. And here there's an asterisk also just to show that the ones that were dropped from 2019 doesn't necessarily mean all the questions were dropped. So for instance, the food behaviors module from 2019, it contains a question on, I believe, using electronic devices while eating an evening meal together with your family. Even though food behaviors was dropped from 2023, that same question exists in a different module in 2023. And so that's, dropped from 2019. It exists in 2023 under our other healthy living module. Before I move to the next slide, I do want to highlight that CHSCY is a pretty unique survey because not only are we following up with 2019 respondents 4 years later, we're also seeing a pre and post COVID type of analysis on children's well-being, which I think is pretty useful. So we're following them 4 years after, granted, but we're also seeing them before COVID, the COVID-19 pandemic hit, and now that the COVID-19 pandemic isn't, or post-lockdown, I wouldn't say it's post-COVID-19 because it's still going on. So this is a little bit of the research work that has been done by StatCan using CHSCY 2019 data. Bullying and victimization among sexually and gender diverse youth in Canada, the number of children that have experienced separation or divorce of their parents, the use of childcare before and after school in Canada, and of course, cyber victimization and mental health. This is just to name a few. These are done by StatCan, but there have been other studies outside of StatCan that have been done using CHSCY's data. Onto our dissemination plan, which I think is the most important part of this presentation. So the data for the longitudinal component of CHSCY has a planned release of May 2024. The master file is going to be made available through the RDCs, but the share file is solely available to our share partners. Along with this, the data released in May of 2024, a daily article is also set to be published this May, along with some code art tables. For those that are not familiar, it's just public tables that are available on the StatCan website. As for our cross-section, that's currently in collection until March. Then we have a planned release of December to the RDC. This cross-sectional component is also going to get an article of StatCan Daily published alongside for the release. Finally, looking ahead for CHSCY 2023 is likely not going to be the last iteration of CHSCY because CHSCY is becoming an annual cross-sectional survey with 4 years of collection starting this year. The annual sample is going to be about 60,000 for the provinces and about 3,000 for the when you compare 2023's CHSCY's to 2024 planned, CHSCY, it's going to be an average time about 35 minutes versus 45 to 15 minutes for the CHSCY 2020 survey. So it's slightly shorter. As for content, the content is going to be slightly different. However, the modules that address our 4 shared health priorities will be left in the survey. And just to recap, our 4 shared health priorities are expanding access to family health services, including areas, supporting our health workers and reducing backlogs, improving access to quality mental health and substance use services, and lastly, modernizing the healthcare system with standardized health data and digital tools. So the modules that address those 4 priorities are going to be left in the survey. And with that, I am concluding my presentation. Thank you. I'm going to go ahead and stop sharing my screen.
Thanks, Eton. I'm going to be up next, folks, so I will just share my screen. See that okay? Yep, okay. So good afternoon, folks. Thanks for joining us today. My name is Emma Nolan, and I am the research fellow that is associated with the CHSCY within McMaster and the Offord Centre for Child Studies. I'm excited to be here today to discuss our work, and I'm going to be particularly focusing on the longitudinal component of the CHSCY. As Eton has discussed, there is a longitudinal component and also a cross-sectional component. I'm going to talk about the longitudinal component today that was made possible through our CIHR funding. And our mission with the CHSCY is multifaceted. We aim to not only really generate actionable kind of evidence for policy, but also navigate the complexities of health research disparities exacerbated by the global pandemic. And the essence of our work really interweaves the CIHR grant objectives and focuses on social inequalities as a kind of cross-cutting theme. And our team received the CIHR funding through the project grant competition in the spring of 2021. And this grant is led by Professor Kathy Georgiadis, along with a large team of co-PIs, co-Is, trainees, and international advisors as well. And the funding, I think, is really a testament to the relevance and urgency of this work. And it sets the stage for continued investment in longitudinal data in Canada. Our grant proposed to leverage the 2019 CHSCY, which was a nationally representative sample of around 48,000 children aged 1 to 17 at the time. So our grant is to conduct a follow-up survey when the children and youth are now between 5 and 21 years of age. And as Eton has discussed, Statistics Canada have been responsible for the data collection, and we have been working with them to develop this work over the last number of years and months. And briefly, the main objectives of our grant are really to examine the longitudinal changes in child health and functioning and compare pre-pandemic and post-pandemic data. As Eton had discussed again, this is a unique data set in that we have kind of data that was pre-lockdown and post-lockdown, and we're following the same children, youth, and their families at both time points. And we want to determine the extent to which these changes are more pronounced among specific population subgroups and communities, and really kind of uncovering the differential impact of the pandemic on children and youth. We have secondary objectives that kind of extend these primary objectives within this grant, and they are really kind of about examining the indicators of health, looking at mental health disorders, mental health symptoms, distress, suicidality, self-harm, and health potential as well, which includes things like psychological and social well-being, self-rates of health and mental health, and life satisfaction. And we also want to examine the prevalence, the distribution, the correlates, and the longitudinal predictors of mental disorders and associated services post-pandemic. So it's kind of a really kind of broad outline of what our main objectives are within the Offord Centre and McMaster, and how this has been funded by our CIHR grant. I want to talk a little bit about our kind of thematic priorities that are aligned with our grant objectives. And as a large research team, we've refined kind of 4 thematic areas that we believe kind of address the objectives that I've just discussed. And we wanted and we're continually asking ourselves the question, what evidence can we generate that has relevance within policy and that can address, questions within policy and strategic development, and how can the CHSCY do this? And some of this aligns with our grant, and other parts of it are complementary to the grant. So this is our thematic priorities. And at the heart of this work, which you'll see in the middle of the image, is a cross-cutting theme that really is focusing on trying to understand social inequalities and disproportionate impacts of the pandemic. That's the kind of center of a lot of the research that we're doing. And when we talk about health, and we use language like health, I want to highlight that we're trying to be inclusive as well of physical and neurodevelopmental, mental health. So this is very broad and inclusive terminology. And for example, when we talk about health services, we're thinking about services across sectors. We're not just thinking within, kind of professional or practice sectors. What we're thinking about as well is within education, within social services, and any sector really that's providing mental health care to children and young people and their families. So we're keeping our terminology broad when we're discussing these themes, but as we narrow specific objectives and we look into these research questions, we may want to narrow that language down further. Theme 1 is really looking at longitudinal changes in health and functioning pre versus post-pandemic. And that's at the top of the diagram. And it's looking at, how has health and functioning changed over the course of the pandemic. And this very much aligns with a number of the objectives that we specified in our grant. And we're exploring how the pandemic has altered the health landscape of children and youth across Canada. We recently submitted a paper exploring the idea of functioning in the 2019 CHSCY. And what we wanted to do with this is conceptualize the idea of functioning. What does it look like? How do we understand it? How do we model it? How do we code it so that we can track this over time and look at it in 2023 as well? Basically, how best to represent the concept of functioning within a national sample. And we'll build on this work and we'll identify risk factors, protective factors, and leverage the national variability in response to the COVID-19 pandemic and understand the impact on children's health. We want to know what the longitudinal changes and predictors of health are. Has the pandemic altered this? And to what extent are these changes more pronounced for select populations, for select subgroups and communities? We're looking really to identify risk and protective factors associated with change and try to understand, the kind of variability across the country and use that to characterize potential modifiers of change. So, not just understand it as a whole, but looking at it across certain jurisdictions, were there kind of prolonged school closures in certain areas that affected health and functioning? Did we see a greater decline in children's health and functioning as a result of this? And we know in kind of health sciences or anything like this that we can't attribute this definitively. But if we want to understand the impacts of the pandemic, asking these types of questions within this type of data can help us leverage it to get a little bit closer to understanding the impact of the pandemic and how it was associated with health over time. Theme 2 is focused on health service utilization patterns. When we're examining health service utilization patterns, we are aiming to characterize barriers to care and the impacts of that. We want to know who, faces these barriers, how they affect health outcomes. And this is really crucial for targeted intervention and understanding these types of questions. We will be characterizing the patterns of various health conditions across various sectors, for example, and really trying to understand the barriers and how continuously, for example, experiencing barriers may negatively impact children's health and functioning, and looking at who's most likely to experience these barriers. We will also explore if there are differences during the pandemic of greater barriers of care for certain health conditions relative to others and the associated impacts of this. And theme 3 is focused on economic related disruptions and government supplements. So this really focuses on kind of employment income disparities, the health implications of this, examine concurrently educational disruptions, aiming to understand their impact on achievement and how, we can understand this as it relates to policy responses. Did this mitigate widening inequalities? Can we characterize dispersion in employment income and, economic circumstances? Who was most likely to experience these disruptions, and have these disruptions impacted health pre versus post-pandemic? The fourth theme is focused on educational disruptions and associated learning losses. And in this theme, we're going to be examining kind of educational upheavals, the consequences, for example, of learning setbacks as a result of the pandemic. And this area is particularly poignant as it highlights the pandemic's far-reaching impact beyond health, touching kind of the very future of the youth and their educational achievements and what they will go on to do next. Exploring who really bore the brunt of these disruptions, and critically, how government policies or mitigation attempts impacted the kind of growing divide that may exist. And while there is overlap in all of these themes, of course, we have a very large research team. Many members have incredible expertise in these areas, and undoubtedly these things kind of do overlap and they are related. But setting these kind of broad thematic areas has really helped us ensure that we're looking at these different components of the data set that are important to understanding the trajectory of child health, the impacts of these areas, and what the story of these thematic areas tells kind of pre-pandemic, intra-pandemic. And as I mentioned, we have this cross-cutting theme of social inequalities and disproportionate impacts cutting across all of these thematic areas. And in order to do this well, we must think about the influence of all of these thematic areas and how they are related to help us answer the questions of the impact of the pandemic and how health and functioning has changed in children and youth. And I also think it's quite important to highlight as well that in the 2023 CHSCY, with lots of advocacy and support from the Public Health Association of Canada and agreement with Statistics Canada, there is an exciting development, which is the inclusion of a module on child maltreatment. And this is a first for this survey. This edition opens up many new avenues for addressing public health and policy questions. It's a new content area and module in the 2023 CHSCY that has not been previously included in these types of studies. And what this does is kind of really help us understand these kind of profound health implications that child maltreatment might have on children and youth. It puts Canada on the global stage as well, and kind of really keeping up to date with other countries in this area of research. And the inclusion of this module really enriches our data set, but allows us to weave a more comprehensive narrative about the challenges and adversities that children may face. So we can imagine the number of questions that are going to kind of emerge from that. And with the leadership of the Public Health Agency and Statistics Canada, we can address these comprehensively. I also want to give a bit of insight into the collaborations that we've had as a research team. To date, we've hit several key milestones as it relates to the work and working collaboratively. We've formalized the trilateral partnership, and that includes our CIHR-funded research team at McMaster and the Offord Centre, Statistics Canada, and the Public Health Agency of Canada. And this collaboration really underscores the interdisciplinary and cross-sectional approach we're taking to address the pandemic's impact on child health. We've developed a kind of external steering committee as well that is really bringing together experts and stakeholders from various fields to inform our research direction and implementation. And I think this project really represents the collaborative effort, and it spans multiple disciplines. It brings together a diverse group of stakeholders, and it spans continents as well. We have an international advisory team. It includes national, international academic researchers or federal partners, as I've mentioned, and also partners in national child health organisations such as Children's Healthcare Canada and UNICEF Canada, as well as a dedicated legion of trainees working behind the scenes as well. And another primary goal of the CHSCY is of course all of our thematic areas and understanding the data, but it's also about working collaboratively and closely to foster integrated knowledge translation and policy impact as well. And through these strategic partnerships, we're really aiming to make sure that we make a real difference in how child health is approached, both in Canada and around the world. And we're working very closely with organisations and our federal partners to also look at this globally and understand global assessments and comparative analyses that CHSCY data now allows us to do. These efforts are crucial for understanding where we stand in terms of child health globally as well. As I've mentioned, our partnerships include UNICEF, Children's Healthcare Canada, the Paediatric Chairs of Canada, Maternal, Infant, Child and Youth Research Network, and the Canadian Paediatric Society. Of course, very closely working with Statistics Canada and the Public Health Agency of Canada. And as I mentioned, our international academic partners to help us engage in these global understandings of child health. And we're now able to begin to develop for the first time a national understanding, prevalence estimates of child health, understand their predictors, their correlates, and work with our partners to ensure that we're translating it in a way that has real work impact. And you know, it's also Canada's also in a great position with this data set because, as Eton has mentioned, and as I have mentioned, we have pre-COVID data and we have kind of post-lockdown data, if that's how we're thinking about it. It's also longitudinal in nature. It's nationally representative. So it's really going to inform us not only of the impacts of the pandemic, but currently where we are in terms of child health functioning across the country. And the need for this work has never been more urgent. We're focused on generating data to inform strategies that help mitigate the long-term impacts of the pandemic and to support recovery efforts across the country as well. And the 2023 CHSCY establishes a foundation for an ongoing national programme of child health, data collection and monitoring, which Eton has already touched on. You know, really thinking about longitudinal inclusion of this as well is really important, and it's a really significant step forward in developing informed policies. And, you know, I don't think I can emphasize that our collaborations, I can't emphasize it enough that our collaborations are at the heart of this project, and they ensure that our findings really contribute to the academic knowledge and have practical implications for improving the lives of Canadian children and their families. And that includes addressing the challenges posed by COVID-19 and enhancing our preparedness for future health crises. The established research policy collaborations will continue throughout the project. You know, we have a plan for this to continue to inform priorities, to inform our analyses, and to guide our scientific and policy interpretations as well. In our journey forward, I think communication is key, and that's why doing these types of kind of open mic sessions and really discussing the data, discussing our priorities and our collaborations is really important. We're committed to sharing our findings and insights through various channels, including the media, public talks, academic presentations, policy consultations, and really foster a dialogue that aims to bring about change. And as we really continue with this important work, I think it's important to remember that our ultimate goal is to improve the health and well-being of children and their families across Canada. And it's a collective effort that requires patience, it requires dedication, and it requires open communication, which is what this kind of collaborative nature has been so great in doing. And I thought it would be nice to finish with some of our partners have said regarding the scope and usefulness of CHSCY. So the Offord Centre, we have what we refer to as CHSCY check-ins, and they go out monthly, and you can access these on our Advancing Youth Mental Health website. We send out monthly communications around the work, what we're doing, what we're focusing on, what's coming out. And as part of this, we've interviewed some of our partners for their perspectives on this work and their kind of ideas on what CHSCY brings to data across Canada. So we work with, and we have interviewed Emily Grunwald, and Emily is the president and CEO of Children's Healthcare Canada. And again, this is our big focus is thinking about policy and impact. So working with these partners is crucial. And Emily highlighted the opportunity that CHSCY provides in terms of understanding the data and understanding children's health across Canada. And she referred to CHSCY 2023, giving us a really unique opportunity to evaluate the impact of COVID-19 and the impact that this has on kids in the country with measures pre and post pandemic. As we say, this is a really unique opportunity for Canada in this sense. It's really novel information that will help us better prepare programs and services for this cohort of youth and also better plan for the future. We also interviewed Lisa Wolf, and Lisa is the Director of Policy and Research at UNICEF, and Lisa discusses how UNICEF Canada want to engage in this data. They're very committed to being a part of this, and UNICEF, you know, she refers to UNICEF as being the part of the community around CHSCY, and they very much are, and that they're really keen to look at how we use the data for advocacy priorities that we have. In Canada, they're promoting stronger social protection and social policies for children, and that we know that deficits in these policies show up in children's health. So this survey that's measuring child health allows us the opportunity to look for the linkages with other data, for example, administrative data, and really understand what we can learn about this around policies and evaluate the outcomes within the survey. And lastly, one of our international advisors, Professor Kathleen Marikangas and Professor Giovanni Salam, they talk about how CHSCY is shifting the landscape of psychiatric epidemiology. And what they mean in this, and what I've kind of tried to emphasize in this discussion, is that they're setting the standard for these longitudinal health surveys on children and youth, which is something that lacks globally. We don't have a lot of information on longitudinal data in children and youth. And Professor Marikangas and Professor Salam discussed that CHSCY is really setting the standard for how we should think about data and mental health disorders in children and youth, and how impairments and data and understanding impairments are lacking. And they need to move in a similar direction to what the CHSCY is doing. And this is from the National Institute of Mental Health and the Childmind Institute in New York. So what we can see as well is not only is CHSCY setting the standard for how we think about children's health across the country, it's setting the standard for how we should be moving towards data globally as well. So that's exciting, and that's an important acknowledgement. And, you know, in conclusion, I kind of really just wanted to highlight that with the collaboration and the willingness from all of these partners and everything we've discussed, the 2023 longitudinal component of CHSCY is really going to enhance our understanding of the impact of COVID-19 on youth and their families. It's going to help us inform policy and practice and prevent kind of widening health disparities. It's going to improve approaches to future pandemic preparedness, if there is another one. And it's going to generate urgently needed evidence to inform solutions that will set a course for a brighter tomorrow. And the thematic areas that I've discussed today, you know, longitudinal changes in health, longitudinal changes in functioning, health service utilization patterns, economic and educational disruptions. It highlights the breadth of this data and the opportunity for this level of inquiry. The themes, as I mentioned, they don't exist in isolation, but they are interconnected threads. And it's important to think about it in this way. And as we move forward, our findings, you know, as I said, they won't only contribute to the academic knowledge, but they have the potential to influence policy and practice. And it kind of really adds a beacon of hope and a call to action for policymakers and educators and communities to come together in mitigating the adverse effects of the pandemic. Because not only can we understand what predicts these longitudinal mental health conditions or health conditions, we can also understand what mitigates them and what protective barriers may also exist as well. I wanted to finish just with a thank you as we conclude today's discussion on the CHSCY. It's crucial to reflect on the journey that we've embarked upon to date, the milestones that we've achieved, and the path that lies ahead. You know, our research, as I said, is generously supported by the CIHR funding. And this has really allowed us to leverage a really comprehensive data set from 2019 and follow up with a significant sample in 2023, which is going to help us understand the nuanced impacts of the pandemic. Our collaboration today with Statistics Canada and the Public Health Agency of Canada bolsters our kind of and exemplifies the power of partnership in addressing these complex health issues. And as we continue to analyze the data and our findings, our focus remains on contributing to a body of knowledge that highlights disparities, but also informs strategies to address them. And this is the potential that this research offers. And I really wanted to finish with a big thank you to our broad team, again, led by Professor Kathy Georgiadis, our co-PIs, our co-investigators, our trainees, our advisors, and of course, a huge thank you to the children, youth and families who have willingly shared their time and their experiences in both the 2019 and 2023 data. The path ahead is both challenging, but also full of potential, and it is through these informed kind of collective efforts that I believe we will make the most substantial impact on health and well-being for children and their families across Canada. And I'm going to finish there. Thank you.
Hello, I guess I'll go right into my presentation. Make sure I'm sharing the right one. And hello, as was mentioned, my name is, I am sharing? No. Hi, my name is Adam Probert. I'm a senior epidemiologist at the Public Health Agency of Canada. I'm joined by my colleagues, Melanie Varin and Justin Lang, who work in other areas of the agency. And you'll see how big we are in a few slides. So just a quick outline of what I'll be talking about today is I thought I would take the opportunity to not only speak about how PHAC uses the cross-sectional component of CHSCY, but a little bit background on why we're using it for public health surveillance. So speaking about surveillance at the agency, going over at a high level some of our surveillance activities and the need for data on children and youth. Some of the other data sets we use to accomplish our activities, and then going into a little bit more detail on how PHAC has used CHSCY data from the first cycle and how we would like to use CHSCY in the current cycle. And then some ideas of my own to get sort of discussion going about how research using CHSCY can support surveillance. Okay. So just a little bit of a background about public health surveillance and our activities at the agency. Surveillance is tracking health events and health determinants through the collection, analysis, and reporting of data. It is really the background of public health. And with surveillance data, it makes it possible to identify and forecast threats to public health, such as disease outbreaks. For example, monitoring the incidence rates of childhood cancer to see if there has been a change in or delays in healthcare seeking due to the pandemic. Surveillance data can also create practical evidence-based policies and programs. An example, we use surveillance data to help determine which projects through our Autism Spectrum Disorder Strategic Fund get funded based on the needs in various communities. Surveillance data can also meet Canada's international public health obligations. There are a number of reporting, WHO, PAHO, UNICEF, where there's indicators on child health, and Canada gets ranked on other countries on basically how well we're doing when it comes to child and youth health. So in Canada, there is a shared responsibility for surveillance. We involve regional health authorities, provinces and territories, other federal agencies. We conduct many activities, as I'll outline in detail, related to key public health topics, specific diseases, health behaviors and outcomes, chronic conditions. And we do this by working with partners to develop population-based surveys such as CHSCY, and then reporting that data on to determine emerging trends and relevant issues. So I'm not going to go into the entire outline of PHAC, just to help focus the presentation today. We have the advantage of having 3 ministers. And I'm sure over the last couple of years, people have gotten used to hearing our Chief Public Health Officer, Dr. Tam. But my colleagues, Melanie and Justin, we work in the Centre for Surveillance and Applied Research in the Health Promotion and Chronic Disease Prevention branch. Justin is in the Applied Research, Melanie's in Behavior, Environment, and Lifespan, and I'm in the Lifespan, Chronic Diseases and Conditions. And you'll see our focus is related to that. Within CSAR, our team leads the development and implementation of various activities to support the national surveillance of health and chronic conditions across the lifespan, of course, including children and youth. We use this data to contribute to the evidence base that helps support policy and program development and evaluation of those programs. And we also do research on its own. So some of the activities that we have in our team, a lot of what we do is we develop, analyze, and report on a variety of health topics, including asthma, developmental disorders, diabetes, congenital anomalies, use of mental health services, childhood maltreatment, suicide ideation, head injuries, concussions, positive mental health, and physical activity. We also lead and contribute to applied research that helps inform surveillance, prevention programs, and policy activities, such as large population health modeling projects and evidence synthesis projects. We liaise with key internal and external stakeholders, and we're also judged under some legislative frameworks and ministerial commitments, which have increased the need for frequent and comprehensive surveillance data. We have a bill that was passed for a framework on autism spectrum disorder. There are currently frameworks in the Senate being debated on FASD and ADHD. There is a children's health study that the Standing Committee on Health is developing. And there's also minister commitments that are in the mandate letters. So just a brief description of the child and health data landscape. We use several data sources along with CHSCY, but data in children and youth are available through several federal health data partners, not only our own agency, but Health Canada, StatCan, Indigenous Services Canada, CIHR, and CHSCY. Specifically, we use administrative data such as hospitalization, emergency department visits, and physician claims data, vital stats, births and deaths, as well in some instances we have coroner reports. We also have other novel data sources such as CHSCY for youth cancer and research projects with the Canadian Pediatric Surveillance Program. Not only CHSCY, but we also use the CHMS, CCHS, CTADS, the former GSS, and HBSC, along with the COMPASS program at University of Waterloo. So to get back to focus on CHSCY, the survey does fulfill many of PHAC's surveillance requirements. 2 cycles, well, of course, the current one, and as we heard from Eton's presentation, future cycles will allow for trend analysis. CHSCY is national in scope. We are a federal agency, but will allow provincial comparisons. CHSCY covers our priority health conditions, risk factors, and behaviors, and has socioeconomic data for detailed analyses. CHSCY also requests personal identifiers, which allows for the potential for future record linkages with health administrative databases. It allows for an examination into health equity among diverse populations, and the longitudinal component will identify impacts of the pandemic on children and youth, as we heard from Emma's presentation. So how does PHAC currently use data from CHSCY? I'm not going to list every single project we have, but just to highlight some of the ones that we do. We monitor a variety of health behaviors and outcomes specific to children and youth and disseminate that information through various knowledge products. We have a number of indicator frameworks. We have the Positive Mental Health Surveillance Indicator Framework, and also the graphic shows the PASS framework as well. We also use CHSCY to provide information to support the development of national strategies and policies. And below is an excerpt from the Autism Spectrum Disorder report, which feeds into that framework that I mentioned earlier. We also use CHSCY to research factors related to children and youth health. And as a government agency, we do get lots of requests from ministers, the CPHO, other policy groups, media, and the general public to respond to various child and health issues. So going into some of the details that our specific units have done, my group, LCDC, we've published a couple of reports. When this slide presentation is shared, those links will be active. So we have a couple of published papers on the prevalence of autism and FASD using CHSCY. Melanie's team, the Behaviors, Environments, and Lifespan Division, has done a number of reports looking at sleep and mental health, validating the Children's Intrinsic Needs Scale, and looking at injuries, as well as gender identity and sexual attraction. Justin's team has a number of research projects in progress or planned, including autism spectrum disorder, looking at functional difficulties, autism in adults, and how autism could be affected by household income, as well as a number of planned activities on physical activity. And you can see those projects there. And I thought I'd take a little bit of a sidetrack to talk about how research, as we've heard, and surveillance can coexist and how they depend on each other. So this is an example I stole from the US CDC. But if we start at the top left, public health research by our colleagues at McMaster, StatCan, and other people in the audience can use CHSCY and other data to identify risk factors in vulnerable populations for various child and youth factors. So then PHAC takes that data and information, develops programs to, say, promote screening and diagnosis and early intervention for various health conditions. We then look at the public health impact of those conditions, looking at especially the impact of those vulnerable children and youth to ensure that they are screened and diagnosed, and if they have the condition, receive the proper care and supports as the rest of Canada. And then surveillance is used to actually monitor whether or not we're doing a good job, whether those programs and policies have been effective, depending on what the purpose of the program is. Are the prevalence of conditions or behaviors changing in the way we expect? If not, well, then we go back to research. So what are the reasons for why these programs are not having an effect? Are there other groups that are now the highest risk for developing certain illnesses? And then just to finalize, to get some discussion going with the group in the time we have left, is here are some of ideas that I came up with. These are not PHAC activities or anything we have planned, but just in terms of how research can then apply to some of the surveillance gaps, and then how can we develop various programs if needed. So looking at the long-term consequences of those with child and youth illnesses. So as we heard, well, we have the longitudinal follow-up of the 2019 CHSCY. We'll have future cycles, and there is the possibility of doing record linkage, probably beyond my retirement, say anyone with certain behaviors in their teens, any conditions they had in their childhood. Well, how does that affect their health when they're in their 50s and 60s? Those are the type of activities we can do. Some of the care and services that children with certain conditions have are limited. That means when they turn 18, those services are no longer available to them, but they still may have a need for those services. So where do they go? Are they still able to access the care that they need? And then similar to the first point is, does having a childhood illness predispose to other health conditions? Some of the ideas I think Emma mentioned as well relates to functional limitations. So instead of focusing on a diagnosis that a child has condition X, maybe we should be looking more at the prevalence of the physical and mental challenges that they have. Do they have problems learning, speaking, with various seeing problems? Maybe those are the ones that we should be doing surveillance and doing various services are to improve their health, rather than giving them a name of some condition which may not relate to the care that they need. Research can also help with undersurveyed populations. There are gaps in CHSCY. They don't include children in institutions or foster care, on First Nations reserve, experiencing transient housing or homelessness, or speak various languages. So there is a need to develop methods so that future cycles of CHSCY can include these populations. And then just to conclude, at PHAC, public health surveillance and applied research on children and youth is part of our mandate. Survey data with CHSCY in particular is critical to our surveillance and activities. As I said, it's national. There's potential for assessing trends over time. It covers our priority health conditions, risk factors, and behaviors, and it allows examination into health equity. And then with our colleagues in the research world, we can help identify surveillance gaps. We can help identify research gaps, and both of those can help inform future health promotion policies led by PHAC. And I think that will be it for me. I think we have, what, 40 minutes for questions?
Up to and including. Thank you everyone for your presentations. That was very, very informative. We've got well, I think one thing in the chat that is unanswered. Someone asked when the data was going to be released, and then Eton immediately told us when it was going to be released, so that was helpful. Can someone speak to the geographic levels? I think this is somebody, and Michael, correct me if you're wrong, who's using the data from a community organization and is more interested in sort of the public releases. So it's probably a question for Eton.
Yeah.
He made reference to a dashboard, which I gather is all of Ontario, and is interested in sort of sub-provincial level data, whether it be at the health region or census region.
Yeah, I can answer that. Hi, Michael. So CHSCY is available at most geographic levels, I believe, including census division. We also have census subdivision. I will say that for smaller the geographic level, our sample size is going to come into play. If you're accessing it through your RDC, I would speak to the RDC analyst about that. But yes, it is available, so you can definitely see the data that.
Yeah, I think so to answer, maybe expand on that a little bit. Michael, this is the RDC, you know, the research data center sort of focused stuff. I don't know about public dashboards that are going to do that, but if you want access to the raw data, you can access it through our centers that way. That's the master file. That's like the line by line survey responses, and you can do your own analysis on the data that way. But I don't, StatCan doesn't usually publish sort of very detailed level tables for this type of product, unlike the census where you can get sort of very detailed geographies.
Yeah,
No, understood. That's great. I appreciate the answer. I am looking for more of a public release, something that, you know, we would be disseminating to a large number of community organizations. So something a little more suitable for public consumption.
So in terms of public releases, we have some CODR tables coming out in May, but those would be at the provincial level. So nothing small provincial level.
So anything lower than that would require like a custom order.
A custom order or accessing it through the RDC, but again, the size issue might come into play when you start to look to smaller geographic levels.
Okay, great. Thanks a lot.
Thank you. So more on that, because I think, you know, given the topic, if the geography for the survey is sort of census related, what's the process for mapping that into sort of health regions, if that's the sort of level of analysis that you'd like to do? Probably a question for Adam, but anyone feel free to jump in.
I think it really depends on the condition. I know my focus is in the developmental disorders area, and for like FASD, there was like under 100 cases in Canada. So you're not going to want to do anything even at the provincial level with that information.
Right.
So I think if it's focused on questions maybe related to, I don't know, behaviors or access to care, or the type of question where everyone is going to have an answer, like whether it's 0 or 100 or something to that effect, where you would have the data. But yeah, like, yeah, I don't know. We don't tend to do a lot of mapping at the census division level. If any of my colleagues at the agency want to leap in.
You don't have to. That was a perfectly fine answer. So this is a very open discussion. So okay, there we go. Will there be some derived data, for example, to link each line to census equivalence, and what would the most detailed geographic level be? Corinne, why don't you come on? I'm not 100% sure I understand that question. Derived data, it's in StatCan parlance, is usually like a combination of a couple variables, and then you get a new variable out of the combination.
Like a BMI.
Yeah.
So I was thinking in terms of the geographic information, because you know where these people were living, I assume, to probably the postal code or maybe the address, but that would be very private information.
Mhm.
The census data has data at the city level, I'm sorry, I'm forgetting the terms because I haven't worked with the data for a year or two, but there's various different levels of granularity of geography
Mhm.
that the census data is mapped to. And it would be really nice if the addresses were tagged with the same identifiers for geography that the census uses. So it'd be easier to compare the Calgary district with all the respondents in the Calgary district by having that Calgary district tag identifier added to the CHSCY data.
So I can go ahead, yeah, that I understand your question. I can go ahead and answer that. So I believe we have all the way down to census division health regions. We have all almost, I wouldn't say almost geographic levels in the master file that's available through your RDC. That's available to data users. And I believe those are census geographic. So if you wanted to access that, it is available through your RDC.
So at an address level, it's available?
No, not address, so geographic levels all the way down to, I think even postal code is available in the master file as well, but not your particular address. So if you want to see something in a municipality, or you would be able to see that, but not so much the street and house number, all that, not the full address.
And how about the for the public data, would there be some kind of an identifier so you could at least see at a city level or below?
And when you say public data, you mean a PUMF, a public use microdata file?
Yes.
Unfortunately, CHSCY does not have a public use microdata file, not for the 2019 or 2023.
Oh, sorry, I misunderstood that then.
Yeah.
Because weren't you talking about a public release of data?
So just released to data users in the RDC, not so much public as in the Canadian public. It's for people who are deemed employees or people who have gone through security clearance and can access the data through their RDCs.
Yeah,
that's what's meant by a public release. Yeah.
So you could apply to access the data at one of our secure labs, but you wouldn't be able to do it from your office. You'd have to come in and work in the locked room with our computers and our stuff. It's no internet, no nothing. So
so the only way this data will be released to the general Canadian public is after it's been analyzed and summarized and presented with context.
Yeah, so there's going to be a daily article coming out this spring/summer, and also in December of this year, and then there's also going to be quarter tables that are released along with that article. So that's, I guess, the most public information about the data without having to apply. That's going to be available.
Okay, thank you.
Welcome.
And DeLawrence, go ahead. Yep, there he is.
So thanks so much for your presentation. Can everybody hear me clearly?
Yeah. We do.
Okay, yeah. I'm in pediatric rehabilitation, and I'm just wondering why there were some disabilities included, like autism spectrum disorder and then fetal alcohol syndrome. And then some other disabilities were left out, like let's say CP or maybe hearing impairment. And how do we kind of negotiate those within the data to be able to capture the meaningful experiences of children with other types of disabilities that were not specifically named within the data set?
So I can speak a little to that. So CHSCY's content is mostly determined by consultation with different experts, federal partners, provincial partners, and the final content is determined by those meetings. And so depending on what's been decided in those meetings, that's what's going to make it into the survey. Not to say that the disabilities not mentioned are important. It's just based off of field research, and again, those consultations that CHSCY's content is determined. So you're going to see some, you may not see some, but yeah, that's pretty much the story there. Yeah.
Yeah, so
Oh, go ahead, Adam.
I was going to say there is an other specify in the long-term conditions as well. Although, yeah, I don't know how one actually sees what the other category is. I thought I heard at one point, if there was a category that got maybe 10 or 15 results, it would make it onto the file.
So for the other specified, they are, when the data is put together, it's just put into the other category. If someone's, for example, if there's an anxiety option, if someone writes in anxiety, we code it up to anxiety because that's what the person should have picked. But if any other symptom or not, any other conditions are put into the other category, they're left as other in the data set. But you are right, based off of the number of people who put in a specific condition, that could sway the decision to put that condition as an option in the next iteration of the survey. Yeah.
And just to follow up, so I was just kind of looking at like if people put in other conditions, is it possible, like if I wanted to find out like the experiences of like children with disabilities in general, and then somebody wrote in, let's say, hearing impairment, and then somebody also wrote in like visual impairment, like I could combine the two to look at, well, I mean, the experiences of children with disabilities in general.
Unfortunately, if someone has written in their answer, the actual written answer wouldn't show up in the final data file. Only things that are put in the options would show up in the final data file. And that person who wrote something in that doesn't fit into the existing options, that would be put into other. So that would be an other category. Yeah.
What would you recommend if I really wanted to kind of look at the experiences of like children with disabilities other than learning disabilities and autism spectrum disorder, and I think the fetal alcohol syndrome? I know there are like other projects, like for example, if you have using accommodation in school could be used as like process of like people like with disabilities or not. But in terms of like the general, like what would you recommend would be some key variables that could like tell us like what children with disabilities might be going through, even though we don't really have the actual like data set for children with disabilities, like
so I would say, just as an analyst that works on CHSCY does have a decent amount of chronic conditions related to children. And for the ones that aren't in the survey, I would suggest there are other StatCan surveys, maybe not looking specifically at the same age group as CHSCY, but there are other StatCan surveys that speak on disabilities for people in Canada. And there are also a lot of studies that have been done on disabilities for children in Canada. So I would suggest that would be the first place to look. But sessions like these are very important because we get to hear the type of conditions that are of interest to data users. And again, CHSCY is, we're going to have 4 more years of collection, and so that would sway the decision on the conditions that make it to the final cut, so to speak. Yeah.
Thank you very much.
So Lauren, sorry, I just want to follow up with that because there are other measures you've mentioned that kind of can tap into that. There is included within the CHSCY the Washington Group Child Functioning Module, which was designed to assess disability in children and youth. And it kind of asks about, visual impairments, hearing impairments, seeing impairments, neurodevelopmental conditions, mental conditions, and health conditions as well. So although the disorder that you may be interested in or the disability you may be interested in may not be explicitly included in the CHSCY, there are other questions that tap into disability assessment in children and youth as well that may be of interest.
Yeah, and just to go off of what Emma said, if you are looking for officially diagnosed conditions, there is the long-term conditions module. The child functioning module is, does your child have a difficulty hearing? Or do they have a difficulty walking? So not necessarily diagnosed by a healthcare professional, but that is available to you.
So there was a question about the topics to be released in the StatCan daily. Eton, would you mind pulling that slide up again?
The topics to be released in the StatCan?
Just the release for the scheduled releases. You had some stuff that was gonna come out in the daily, I think.
You can go ahead
Unless
and
I'm misremembering.
okay.
And I think there was a comment during the presentation, while you're looking for that, about the eating behaviors changed in between sort of 2019 and 2023.
Yeah, I can answer both. So for the person asking about our dissemination plan, can everyone see my screen?
Yes.
All right, so the longitudinal master and share files is planned for May 2024,
Yep.
or I would just say spring, summer 2024. And then the cross-sectional master and share microdata files are planned for release in December of 2020. So those are the planned data file releases. As for the data, or as for the daily article, that's planned for the same time for the longitudinal and cross-sectional. So daily article for the longitudinal file, that's in May of 2024. And then for the cross-sectional file, the daily article is going to be released in December of 2024. Each article is going to come with its own coder tables, about 2 or 3 of them. So that would be the public, non-application needed data that's going to be available, or information is going to be available.
Okay, thank you.
And as for the eating behaviors question, I did see that. So the eating behaviors module is one of the modules that didn't change between 2019 and 2023. So is there a specific question within 2019 that you saw didn't make it into the 2023?
I think it was breakfast skipping was an example.
Breakfast skipping. Okay. So that was a question that was dropped from from the 2019 to 2023 survey, but there are other questions that exist in 2023 that could supplement, not exactly identical, but could supplement that information.
Okay.
Yeah.
And so since you're taking feedback too, I'll add that the NLSCY was such a great survey, but maybe we won't wait a decade to link it to tax data and stuff this time, right? Or I guess
So,
2 decades to wait. So
no, so as I mentioned, tax data is available for linkage with CHSCY 2019 and 2023. So you are going to be able to see income information on the household respondent. So we're learning, basically.
Yeah, good stuff. And then all the like discharge abstracts and stuff, that'll all be coming too, right? Yeah, good.
So when you say from the DAD data set, discharge abstract database?
Yeah, and the ambulatory care stuff, just the
Yeah.
other sort of admin health data writ large.
So for right now, it's the tax file from the T1 family file, that's tax return data. Any other linkages that would come a little later, just because, and I believe it's through the SDLE. So yeah, that would come a little later. But for right now, it's for data users, it's tax data. But thank you for mentioning that. I'll mention it to the higher up people.
I might bring it up in a few meetings too.
Yeah, well, I'm sure we're all eager to see that happen. So I'm not worried about it going unspoken. So okay, well, I'm not seeing any other hands in the chat or questions in the chat, and we are never shy about ending early. But I'm glad we had the extra 10 minutes because there were a lot of good questions, and we wanted to give our presenters time. So I'm going to give everyone a round of applause, and I encourage you to do the same. Ryan, can you post the feedback survey in the chat for us, please? We do have a quick event feedback that we like people to fill out. And we'll just let that come up, and we'll say thank you to all our presenters and attendees and everyone. Well done.
Thank you. Thanks for inviting us and organizing.
Thank you.
Thank you.
You're welcome. Thank you.
Thanks.